Hello. In this video, I will cover the pathophysiology of Parkinson's disease and the pharmacology of a common drug used to manage this condition. The Parkinson's disease is a complex, age-related neurodegenerative movement disorder. There are various health domains impacted, leading to a decrease in the quality of life of those affected. The hallmark motor symptoms of Parkinson's are tremors, rigidity, and slowness of movement, such as akinesia and bradykinesia. These are often accompanied by postural instability and arise from disruptions in the specific neurological pathways within the nigrostriatal tract of the midbrain. This chronic and selective degeneration of dopamine-producing neurons in the substantia nigra, along with the abnormal protein deposits containing alpha-synuclein, lead to a diagnosis of Parkinson's disease. The pathophysiology of Parkinson's disease can be characterized by the progressive degeneration of dopaminergic neurons in the substantia nigra, a critical region of the brain involved in motor control. Further neurodegeneration is caused after a loss of these neurons due to a significant decrease in dopamine production. Dopamine is an essential neurotransmitter that assists in the coordinating of smooth and controlled muscle movements. The deficit in dopamine results in the symptoms of Parkinson's disease. A key pathological feature of Parkinson's disease is the presence of intracellular lesions, known as Lewy bodies or Lewy neurites, along with a significant decrease in dopaminergic neurons. Lewy bodies are abnormal protein aggregates primarily composed of alpha-synuclein, disrupting neuronal function and contributing to cell death. Another characteristic of Parkinson's disease is dysfunction of the basal ganglia. The basal ganglia circuitry processes signals from the cortex, which enables the performance of voluntary movements. The degeneration of dopaminergic neurons in the substantia nigra pars compacta initiates a series of functional changes that impairs the basal ganglia network. The most significant changes happen in the output nuclei, the medial globus pallidus and the substantia nigra pars reticulata, which then become hyperactive. The increased glutamatergic inputs from the subthalamic nucleus fuel this hyperactivity. Parkinson's disease is also characterized by issues in the mitochondria and endoplasmic reticulum. A notable cellular dysfunction associated with the disease's etiology is the unfolded protein response. The unfolded protein response involves a coordinated process that begins in the endoplasmic reticulum and facilitate the correct folding of proteins. The Movement Disorders Society outlines that Parkinson's disease is diagnosed primarily through typical motor symptoms, including bradykinesia, rigidity, and tremor. However, non-motor symptoms such as hyposmia, isolated rapid eye movement, sleep behavior disorder, gastrointestinal abnormalities, and depression can be present from 10 years before the appearance of motor symptoms. Accurate diagnosis of Parkinson's disease relies on the extended clinical observation of patients and their response to levodopa. The primary pharmacological treatment for this condition is levodopa. Parkinson's disease is incurable and progressive, meaning that patient symptoms will worsen over time due to further neurodegeneration. This can lead to decreased quality of life and increased disability and dependence on caregivers. Symptoms can be managed with pharmacological interventions such as carbidopa and levodopa. Levodopa is regarded as the safest and most effective medication for treating Parkinson's disease and is recommended for early use after diagnosis. This combination medication is prescribed to alleviate symptoms of Parkinson's disease and related symptoms, such as bradykinesia, rigidity, and tremor. Levodopa is a dopamine precursor and converts dopamine within the brain, aiding in the control of voluntary movement. Carbidopa is a part of the decarboxylase inhibitor class of medications and assists in the prevention of levodopa breaking down in the bloodstream, ensuring more levodopa reaches the brain and provides a therapeutic effect. It irreversibly binds to the pyridoxal 5-phosphate, inhibiting the aromatic amino acid decarboxylase. Additionally, carbidopa, in combination with levodopa, can decrease the side effects of levodopa, such as nausea and vomiting. Thank you.